There are 5 potential coronavirus vaccines in phase 3 trials in the U.S., with the first limited rollout expected by the end of the year.
So our hope is, obviously this will depend on FDA and CDC, that we'll start to see maybe 1 or 2 of the vaccines that actually get through the approval process in December or January.
But the devil's in the details. One medical expert telling legislators today a clear national vaccine strategy is lacking.
But right now, we do not exactly know what the national level coordination will look like. And so I think the state is scrambling from MDH level to try to understand and coordinate a response.
The state's health secretary said the state is trying to stockpile supplies related to vaccine distribution in case the federal government doesn't deliver.
We need more information from the federal government on distribution, cost sharing, and federally provided supplies. That's sketchy right now, and it's really one of my biggest worries, because if the federal government says they're going to provide something and then change their mind, we might have supply chain issues.
What is known, the first 300 million doses of approved vaccines will be given free. A big question, will the public accept it? And who will get it first? The first group in line for a vaccine is considered highest risk: healthcare workers, first responders, older adults in congregate living or overcrowded locations, people in jail and correction staff, people with underlying medical conditions, and judiciary employees. One legislator asked, what about teachers?
This is subject to change, so I will put that out there. And phase 2 is where many of the essential workers are. That would include education. That's where they currently are.
The state health department will be in charge of distribution of a vaccine throughout Maryland. A recent Goucher College poll found that 49% of people in Maryland will not take the vaccine. Reporting live tonight from the State Office Complex downtown, I'm Jane Miller, WBAL TV 11 News.